As of April 2024, cannabis is legal in 38 out of 50 states for medical use and 24 out of 50 states for recreational use. At the federal level, cannabis is still prohibited and considered an illegal substance. California was the first state to legalize medical marijuana or cannabis as a medical tool in 1996. In California, nearly all residents have a marijuana dispensary within their county. California is the leading state in marijuana dispensaries with 3,659 locations all across the state as of 2023. These dispensaries deal in selling cannabis for both recreational and medical purposes, which resulted in $5.1 billion worth of sales in 2023. According to a Pew Research Center study, 59% of U.S. adults believe that marijuana should be used for medical and recreational use, and 30% believe that it should be only used medically. Despite this seeming support, the Food and Drug Administration has not approved cannabis as a treatment for any medical condition. As I mentioned before, cannabis is not even legalized and is considered an illegal substance by the federal government. However, this should change. Cannabis should be regarded as a valuable medical tool. Before we begin, I would like to clarify some definitions of terms that I have used and will use throughout this discussion. Cannabis, commonly known as marijuana or weed, is a psychoactive drug made from dried cannabis plants. These plants contain THC, which is a mind-altering chemical. Cannabis is one of the most used drugs in the U.S., as a third of young adults reported using it in 2021, according to the National Institute on Drug Abuse. The term medical marijuana refers to cannabis that is prescribed by physicians for the patients as pain and symptom relievers for certain conditions. There are many ways that marijuana can be ingested, such as through pipes, hand-rolled cigarettes, known as blunts, vaporizers, and such, smoking tools. Medical marijuana can also be ingested in the form of edibles and topical treatments, which is mainly medical usage. The most common use for medical marijuana in the US is for pain control. So, medical marijuana is effective in treating chronic pain without having intoxicating properties through the extract known as CBD, which stands for cannabidiol, that contains little to no THC, which was the brain-altering chemical that I mentioned earlier. Because medical marijuana can be used without fear of intoxication, it should be considered a viable medical option other than to painkillers. According to Johnson and Wales University, as well as Harvard Medical School, medical cannabis can be used to lower blood pressure, reduce inflammation, prevent relapse in drug and alcohol addiction, treat anxiety and gastrointestinal disorder, prevent seizures, fight cancer, reduce muscle tremors, reduce pain in HIV and AIDS patients, and treat PTSD in veterans who have just returned from combat zones. This plethora of treatments, especially in hard-to-treat conditions such as HIV and AIDS, cancer, should contribute to how using medical marijuana is very valuable. Medical marijuana also serves as a safer alternative to opiates, as you can't overdose on it, and it's far less addictive, which is a big problem in America, the growing opioid addiction. Medical marijuana can also replace standard pain-reducing drugs, such as Advil or Aleve, in those who have kidney problems or other problems that prevent them from being able to take painkillers, which is according to an article from Harvard Medical School in 2020. However, there are some limitations. According to Dr. Peter Greenspoon, who is a cannabis specialist at Massachusetts General Hospital and an instructor at Harvard Medical School, many patients are embarrassed to learn more about medical marijuana due to how the medical community has been very dismissive of medical marijuana as a medical treatment, as a viable medical treatment. They're afraid of being judged and criticized by their doctors for trying to learn more about this valuable treatment. One can only imagine how alone and lost they feel trying to learn about marijuana as a medical treatment, and I feel like patients should be respected, and the medical community should embrace cannabis as a more valuable medical tool. There are some side effects of using marijuana as a medical agent, notably possible drowsiness, dizziness, irregular heartbeats, confusion, and trouble concentrating. Some limitations as to who can use medical marijuana include pregnant women, patients with heart disease, and patients with a history of psychosis, according to the National Library of Medicine. With proper information, cannabis should be regarded as a valuable medicinal tool. The wide range of conditions that medical cannabis can be used to treat include some very hard to treat areas such as HIV and AIDS and cancer. It's important that the federal government does more research to add on to the existing research that confirms the safety and effects of medical marijuana so that it can be approved for medical usage in treatments of conditions federally. The number of people that can be reached and saved from chronic day-to-day pain in the medical conditions that they face is a very large number, and it's pretty important that this level of urgency is reached in order to make sure that their suffering is eased. Medical marijuana can help with the many pains gained as a result of old age, which means that you may know many people who are suffering from these pains. And if you know someone and they're scared to deal with the medical cannabis, the somewhat taboo that is linked with using weed, it's direct them to correct sources of information. You can be the one to help relieve their pain.